evening, and welcome to Future Choices. My name is Fran Snedeker, and I am the producer and moderator of this educational series exploring reproductive health issues. We are filmed at the LMC TV studios in Mamaroneck, New York. It's a great pleasure to welcome you to this special episode of Future Choices entitled Island of Paradoxes. Past episodes of Future Choices have taken you on a variety of virtual trips to Asia, Africa, and North and South America. We will be looking today at a national healthcare program which, according to a 1982 report of the U.S. Congress Joint Economic Committee, is superior in the Third World and rivals that of numerous developed countries. We will be going to the island just west of Haiti and a mere 90 miles from Florida. Yes, we are going on a study tour of Cuba. It is important, first, to assure you that I am no expert on Cuba. I may know a lot about reproductive health care in developing countries, but I've only been to Cuba once. So when I describe to you paradoxes of the healthcare system in Cuba, I'm telling you about what I learned from extensive reading and what I observed during my 8 days on the island last year. The healthcare system I discovered there is multi-layered, multifaceted. So in keeping with the overarching theme of Future Choices series, I will limit my remarks to the healthcare offered to Cubanas, the women across the island nation. With that caveat in mind, come with me to Cuba. I traveled in March 2011 on a study tour of healthcare and alternative healing in Cuba with Global Exchange, an international human rights organization who organized reality tours to a number of challenging corners of our planet in Africa, Asia, the Middle East, and the Americas, including Cuba. So why do I call the Cuban healthcare system a paradox? I don't know of a better description of the many apparent contradictions one encounters when exploring healthcare in post-revolutionary Cuba, aka Castro Cuba. Economically, Cuba is on a parallel with Egypt, Indonesia, and Bolivia. Therefore, it is very unusual that in terms of health outcomes, it's on a parallel with Western Europe, Japan, and the U.S., both on maternal and infant mortality count and also life expectancy at birth. Let's look first at a comparison of healthcare in Cuba in 1959, a year before Castro came into power, and in 2011, when I went to Cuba. Before Castro, Cuba had the best healthcare in the Caribbean, but 80% of that took place in Havana. That's a nice way of saying that healthcare was strictly defined by money. In 1959, the year of the revolution, there were 6,300 doctors. Half of them fled Cuba within a couple years of the revolution. Today, there are 75,000 doctors, half of whom are family doctors, general practitioners. That's an important distinction, as you will see later. Please note, too, that there is no such thing as a private doctor in Cuba. All health care is provided in the public sector. Infant mortality, that is, the death rate of children under the age of 5, was 60 per thousand before the revolution. Today, they have sliced that down to 5.3 per thousand. Cuba's infant mortality rate is among the lowest in the entire world. It is now lower than the U.S. as a whole and less than half the rate suffered by Black families in the U.S. Pre-revolutionary life expectancy was 60 years, and now it's 78, comparable to ours. The number of med schools before Castro was 1. Now there are 24, plus the Latin American Medical School, ELAM, which trains doctors from impoverished areas outside of Cuba, including a number of students from the U.S. Mind you, med school in Cuba lasts 6 years, includes several years of hands-on internship, and is entirely free. So whether the medical student is from Santiago de Cuba, near Guantanamo, or Guinea-Bissau in West Africa, or the Bronx, medical training is covered by full scholarship. Well, how did Castro effect such a dramatic change in the healthcare in his country? Even before coming to power, Castro was talking about the murder of children in poor communities for lack of medical care. No child shall die on my watch for want of medical attention, he proclaimed. Castro announced early on that Cuba would become a world medical power, and he persisted in pursuing that dream, even as Cuba fell into dire economic straits in the early 90s with the demise of the USSR. Castro declared that health care is a right, and that in Cuba it shall be universal, that is, for young and old, women and men, rural and urban residents. It shall be free of charge to all people, regardless of income or political persuasion, and it shall be accessible in every neighborhood, in every province. Everyone gets care, regardless of race, religion, gender, class, sexual orientation, or disability. He decreed that prevention must be holistic, concern for the individual as a whole rather than for just a body part in need of repair. So he turned to that dashing doctor from Argentina, Che Guevara, to design from bottom up and implement a totally revolutionary system of developing health care to his compatriots. Che established the Rural Health Service in 1960, requiring all medical school graduates, who by definition are general practitioners, to serve 1 year in rural health. Since he also abolished private practice of medicine, all these doctors' subsequent posts are determined by the Ministry of Health, not by their own choice. So, what does this mean to the individual Cuban? The first thing I must point out is the status of women has truly been transformed in post-revolutionary Cuba. In 1959, with the exception of a very few well-heeled families living mostly in Havana, few women were literate. Few were allowed to hold jobs outside the home. We were told by the representatives of the Federación de Mujeres de Cubanas, that is the quasi-governmental Cuban Federation of Women.
Antes del triunfo de la revolución, muchas mujeres ni existían.
That in rural Cuba, that is, in most of Cuba, women had no rights. It was as if they did not exist. So, when it was decreed day one that there would be universal health care with a special focus on women and children, this was revolutionary. Let me lead you through Bonita's experience in healthcare. Like every Cubana, she is responsible for getting an annual checkup. For this, she goes to her neighborhood health center, her neighborhood clinic called in Cuba, consultorio. Each consultorio serves a neighborhood of roughly 1,000 patients. To give you a context, a village like Larchmont would have perhaps 4 consultorios scattered in various neighborhoods. Each of these neighborhood clinics is staffed by a family doctor and a nurse, both of whom live in the community, probably upstairs from the clinic. Their job is to respond to local needs. They work a 50-hour week with consultations in the morning and home visits in the afternoon to homebound and handicapped elderly and pregnant women, and follow up on people with chronic conditions. The doctor is also charged with the responsibility of community health education, of conducting hygienic monitoring in the neighborhood, and of teaching sex education in the schools, daycare centers, and maternity centers. In sum, the primary job of the family doctor is promotion and prevention. Since the family doctor lives right in the community, that doctor knows each and every one of their patients personally. Since they probably go to the same grocery store, there's only one in most neighborhoods, the same church, the same shops, they tend to be aware when anyone is doing stuff which will endanger their health. Back to Bonita. She will get a general physical at least once a year with the usual array of lab tests we are all familiar with. She will also enjoy one-stop shopping. Bonita's visit involves a lot of patient education about how to take care of herself. For instance, there's a very strong emphasis on breast self-exam backed up by ultrasound every 3 years. At least partly because of the severe shortage of mammogram film due to the U.S. embargo, mammograms are recommended only for high-risk women. But given the current controversy in this country about recommended frequency of mammograms, this might be a good thing. A breast exam is performed by a doctor or nurse every time a woman comes into any health facility, even if she's only there for the flu or a broken ankle. She must be able to demonstrate to the doctor or nurse that as she leaves the clinic, she knows how and when to perform self-exams at home. If she wants to delay her next pregnancy, she gets contraceptives from the doctor, same doctor. Although, due to shortages of medicine, which the U.S. embargo has created, she may not have much choice about which method she gets. Side effects and warning signs of each method are discussed. If she wants to have a baby, Bonita gets instruction on ways to detect pregnancy early on, and she must commit to start prenatal care the moment she thinks she is pregnant. She's expected to come in for a minimum of 12 prenatal visits. She must submit to extensive testing to ensure that the pregnancy is going well, including tests for HIV, ultrasounds, and the like. Education focused on maximizing the health of the mother and the child is an essential part of these visits. Bonita will be tutored on the importance of home safety and hygiene, breastfeeding, nutrition for herself and her baby, dangers of smoking, a big problem in Cuba. If any health irregularities are identified, she will need to return to the health clinic in her neighborhood the next time one of the specialists from the polyclinic is there on a regularly scheduled visit. Or, if it's more pressing, she will be told to go herself to the polyclinic for further exam. The polyclinics are the next step up in the medical system, the secondary level, with a variety of specialists, pediatricians, internists, OBGYN, psychologists, etc. The polyclinic serves as a backstop for the family doctor. These specialists visit the consultorio on a regular basis to see patients in need of their level of service. Polyclinics cover a geographic area roughly 27,000 people. So these are still pretty close to home. Context again, a town the size of Mamaroneck would have one polyclinic. The family doctor or the nurse from the consultorio will normally visit Bonita at home several times during her pregnancy to assess her living situation, including any hint of psychosocial problems within the family. Not an infrequent occurrence in the typical overcrowded home with multiple generations living cheek to jowl. If Bonita misses a prenatal appointment, she's guaranteed a home visit. If she tests positive for HIV, a test she must undergo more than once during pregnancy, she will be put on a regimen of antiretroviral drugs to ensure that the virus is not passed on to the fetus. Cuba, though, has a very low HIV prevalence of 0.1%. This is 1/6 of the US rate. If other abnormalities in the pregnancy are detected, or if the pregnancy was unintended, Bonita will consult with a family doctor about whether she wants an abortion. It's her choice. Outpatient abortions are performed at no cost through 26 weeks of pregnancy at the nearest polyclinic. If Bonita lives way the heck out in a rural community, she'll be sent to the nearest maternity center for the final weeks of her pregnancy. There are more than 200 maternity centers scattered around the provinces. Her roommates there will be others with high-risk pregnancies. Care there ranges from dental work to vigilant monitoring of the progress of the pregnancy to instruction about taking care of themselves and their baby. All these pregnant mothers will be transferred to the maternity hospital when they are within a couple days of their due date. Cubans boast that 99% of deliveries take place in the hospital and the other 1% in the ambulance on the way to the hospital. A Cuban woman is guaranteed fully paid maternity leave for 6 weeks before delivery and 3 months after. She can receive 60% of her salary up to 1 year if she chooses not to work postpartum. Care about and for the mother and baby does not stop in the delivery room. Within 2 weeks of leaving the hospital, Bonita will be visited at home by the family doctor. Home visits are key for assessment of safety conditions, hygiene, and sanitation in the home. At this time, she'll also get further coaching on breastfeeding and nutrition. At the neighborhood health clinic, her baby will have an intensive schedule of well baby visits through 14 years of age. Most of these happen during the first 4 years. This reflects the determination to eradicate, to the extent possible, all vaccine-preventable diseases. Unfortunately, due to economic constraints and lack of medicine, Cuba is falling somewhat short on this front. That must make Castro crazy. He wants every child to be healthy, not only because he cares. Remember, no child shall die on my watch. but also because he does not want the expense of treating sick babies. And he wants healthy babies to grow up to be healthy children who will be more likely to achieve in school and develop into healthy, educated adults who are able to be productive workers, improving Cuba's economic strength. If Bonita were found to be HIV positive during pregnancy, her baby will immediately be tested for the disease sometime during his first 3 months, and he will be put on antiretroviral drugs if need be. Because the women of the FMC, the Women's Federation, demanded it for the sake of bonitas across the country, lots of daycare centers were built in the 1980s. But when Cuba was faced with financial troubles of this special period in the 1990s when the USSR pulled out, that initiative ground to a halt. Bonita will find that there are not enough daycare centers, especially if her job requires her to work odd hours.
En estos momentos, por supuesto, no son suficientes los recursos.
But if she does manage to place her child in a facility, she will find that the center has a solid medical backup. At least one nurse is assigned full-time to each center, and doctors visit on a regular basis. Bonita can rely on governmental institutions to provide her child with the sexuality education needed to supplement what she conveys at home to her offspring. Thanks to the input of the FMC, the Women's Federation, sexuality education includes not only safe, responsible sex and contraception, but also attention to early learning about the names of those parts of the body hidden between the shoulders and the knees, understanding of appropriate physical contact, gender issues, domestic violence, dangers of adolescent pregnancy, and STDs, sexually transmitted diseases. As Bonita ages beyond her reproductive years, she can still find solace in the healthcare system. Remember, as an elderly or homebound person, she will always be right around the corner from her family doctor, who will see her periodically either in the clinic in the morning or at home in the afternoon. She may choose to become a frequent participant in one of the many grandparent clubs, Círculos de Abuelos, promoting organized exercise activities supervised by her good old family doctor in conjunction with a sports medicine specialist. It would not be surprising to see her and her friends early weekday mornings walking briskly in parks and plazas and public spaces. Bonita will be referred, if need be, to specialists in elder care at the local mental health clinic. Or, if continued cohabitation in tiny dwellings with multiple generations of her family becomes untenable for health or emotional reasons, she might find herself in one of the 150 residential elder care facilities scattered all around the country, providing comprehensive health care in a clean, caring environment, sparse on the luxuries, but bounteous in recreational and educational activities. So tell me, how can one of the poorest countries in the Western Hemisphere provide free health care and achieve such impressive health outcomes? As they said on the PBS series about Cuban health care, aired in December 2010, unlike the rest of the developing world, there's no doctor shortage in Cuba, which means that the healthcare system can push doctors and nurses down to the smallest rural communities, providing a kind of care that is both personal and persistent. And moreover, Cuba lives and breathes the mantra about healthcare: prevention, 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 and promotion, promotion, promotion. What struck me most poignantly about maternal and infant care in Cuba is that every woman and child in every neighborhood, in every province, is supported by the system from soup to nuts. In essence, every bonita has true freedom of choice about the timing of her pregnancies. Armed with a barrage of health education throughout her life, she can make an informed choice about when and if and how often to become pregnant. If she chooses to end a pregnancy, that's her choice, and she does not have far to travel to get a safe, legal abortion for free. If she chooses to continue with her pregnancy, she knows that she and each of her babies will be well nurtured by well-trained healthcare professionals right in her own neighborhood. If she decides to limit the number of children she will bear, that's okay too. Amazing that in a socialistic dictatorship, these decisions are left to the women and not to the government. Every woman gets support whatever she decides. What a paradox. Is it a perfect system? No. It is human. The caregivers we encountered in a variety of situations exhibited not only an impressive level of professional competence, but also, more importantly, compassion and pride in their work and the achievements of the healthcare that Cuba has attained. Most are paid a bare living wage. They work long days and have scarce opportunity for promotion to a cushier job. We are told that well-trained doctors are increasingly leaving their prestigious but poorly paid state healthcare jobs to work as taxi drivers or waiters, where dollar tips can keep a large family afloat. But on the whole, they seem to me to have been born on a different planet from 90% of my co-workers at the DC Health Department, where malingering was a highly prized skill. Yes, there is coercion, but perhaps the real coercion is that Cubans have no choice about health care. They have to take responsibility for their health. They have to go to the doctor, and they can afford it. My sister-in-law, who lived in California, put off getting a mammogram for 5 years because of the expense of the procedure and of her fear that it would yield bad news. By the time she submitted to an exam, it was stage 4 breast cancer. In Cuba, she would not have been allowed that delay. Thank you, and good night.